On behalf of the College of General Practitioners of Sri Lanka, I warmly welcome all of you to this CME program organized by the CPD Committee of the College of General Practitioners of Sri Lanka. And today's topic is Physician in Thyself, which I also personally have very much interest in. And for that, we have an eminent resource person from India, Dr. Sheela Nambiar. I warmly welcome Dr. Sheela Nambiar also for this webinar. And if I want to introduce Dr. Sheela Nambiar for you all, Dr. Sheela Nambiar is MD, is a practicing obstetrician and gynecologist, graduated from Madras Medical College, Chennai, and Manipal University in Manipal. She currently works at Medicide Healthcare Ooty. As an extension of her medical practice, she is certified as a fitness and lifestyle consultant from the National Association of Fitness Certification in the US and started teaching women how to exercise as a form of prevention and for better quality of life in the year 2000. She is board certified lifestyle medicine physician through the British Society of Lifestyle Medicine, BSLM, in 2018. And combined lifestyle medicine fitness into her medical practice as an Obgyn gynae. She is the pioneer lifestyle medicine in India, being one of the founding members of the immediate past president of the Indian Society of Lifestyle Medicine. Dr. Nambiar trained in positive psychology and cognitive behavior therapy, CBT, and uses both in counseling tools for her patients for behavioral change to prevent NCDs due to poor lifestyle habits. She serves on the board of several global lifestyle medicine initiatives like the Lifestyle Medicine Global Alliance, Asian Lifestyle Medicine Council, the Global Positive Health Institute, and the True Health Initiative. She serves on the editorial board of the Journal of Lifestyle Medicine from the British Society of Lifestyle Medicine and on the board of studies of Sri Ramachandra Medical College and Research Institute. She runs her own health and wellness program for women called Training for Life, TFL, both in person and online. The program focuses on chronic disease reversal, behavioral change, weight loss, fitness, and lifestyle. She is a published author for 3 best-selling books on fitness, lifestyle, Get Size Wise, Gain to Lose, Fit After 40, and has been regular contributor to articles on health and fitness for national and international newspapers like The Hindu magazines, and online forums. Dr. Sheela Nambiar is a speaker for TEDx and national and international forums and conferences for corporates and organizations. She's passionate about women's health and empowerment, chronic disease prevention, and travel and animals. So I cordially invite Dr. Sheela Nambiar to take the forum and do this much awaited presentation. Out to you, ma'am.
Thank you, Dr. Bihan. It's been a bit of a task trying to get on this talk because the internet wasn't working and all kinds of issues. I just hope we're able to get through this talk. So allow me to share my screen. Can you see my slides? Is everybody able to see my slides?
Yes, madam, we can see.
Yes, we can see you.
Yes, okay. So physician heal thyself is something that I've been really passionate about for a very, very long time. One of my early experiences when I was doing my first year in postgraduate, when I started my post-graduation in obstetrics and gynecology, I had the terrible experience of my roommate, who was a brilliant final year anesthesia PG, commit suicide. And I still recall the horror and the numbness and the guilt that I felt. And in retrospect, when I think about it, I am just appalled at how little support we all had as physicians to deal with something that was so traumatic. And I think the case is still, it still remains the same. We are expected to compartmentalize our emotions. We're expected to set aside our emotions and deal with patients who also have terrible, traumas and terrible life circumstances, and deal with it without even considering how we take care of ourselves. So today, I'd just like to go through a couple of behavioral strategies, science-based tools that we can use to actually improve our own health and take care of ourselves, just as we are taking care of our patients. So in this talk, I will deal with what is physician burnout and the strategies that we can use for self-care. So self-care is a spectrum of knowledge and skills and attitudes, including self-reflection and self-awareness, that identification and prevention of burnout, appropriate professional boundaries, and grief and bereavement. So physician burnout can be divided into three aspects. It specifically has three aspects, which is emotional exhaustion, depersonalization, and low personal accomplishment. Now, this was coined by Maslach in 2001. According to Maslach, emotional exhaustion is a result of prolonged exposure to and manifests itself through the loss of enthusiasm for work, feeling helpless, trapped, and almost defeated. Depersonalization or cynicism and detachment from your work and from your patients and co-workers. There may be a lack of empathy for the patient, which is also quite common. Low personal accomplishment or inefficacy, as it's called, which could be both at work as well as at home, is characterized by a lack of sense of personal achievement and the individual's withdrawal from responsibilities and detachment from the job. Now, the burnout is actually measured by Maslach's burnout inventory, MBI, which is considered the gold standard, and it has a 22-item questionnaire. But even just asking a physician, do you feel burnt out by your job, is sufficient to get an idea as to how he's dealing with his job. And the symptoms can be irritability, depression, anxiety, poor functionality, poor decision-making, lack of empathy for the patient, frustration, hyper-arousal at small incidents that may happen in your professional or even your personal life, avoidance, and re-experiencing clinical encounters that may have been distressful or traumatic. So the key here is that most people who get into burnout or who are suffering from burnout most often are not able to diagnose their symptoms of burnout themselves. It's usually the other people who point out that, you've been behaving a little strange, you've been extremely irritable and cranky, and, the decision making, there have been medical errors and so on. So it's important to recognize that, because those of us who are in burnout most often are unable to recognize it. Now, one of the, like I already mentioned, one of the most troubling side effects of burnout is, of course, physician suicide. It's a very concerning factor and points to the distress that physicians experience, and the rates of suicide are extremely high, almost reaching epidemic proportions. According to WHO, India's suicide rate in 2019 was 12.9 per 100,000 people and was much higher than the global average suicide rate of 9 per 100,000 population. India is also the highest suicide rate for females and the second highest suicide rate for males in Southeast Asian region, second only to Sri Lanka. Male doctors have suicide rates up to 40% higher than the general population, and the female doctors up to 130% higher than in the general population. So this is really something that we need to keep in mind, and something that has not really been addressed. 27.2% of medical students exhibited depressive symptoms, and only 15.7% of students actually sought treatment. Again, this is of concern because we don't seem to be prioritizing our own health and our own distress while we are going through this very, very tough course that we call, which is our medical curriculum. So multiple studies have indicated that a high prevalence of burnout among practicing physicians have shown that 1/3 of the physicians have experienced burnout at certain points in their careers. In a cross-sectional study that's conducted by Lagande et al., Modi et al., among 482 registered medical practitioners across India, 45% of them scored high in the emotional exhaustion aspect of burnout, and 62% scored high in the depersonalization. 87.4% scored low in the personal accomplishment scale. So this is, again, these are all very concerning statistics, which we need to take very, very seriously if we want to increase not just our own well-being, but the well-being of our patients as well. Burnout is leading to more and more patients going into early retirement, increasing addictions, quitting their own profession, or worse still, taking drastic measures such as taking their own lives. In another paper by Romani et al., physicians who had high burnout levels reported committing more medical errors, and they also studied the effectiveness of interventions to prevent and reduce burnout in physicians. And a meta-analysis of several small studies showed that several interventions, including CBT, mindfulness practices, mindful movement, walking, sitting meditation, and so on, can actually be very, very helpful to prevent or even manage burnout. Now, the physician's health can positively influence the patient's health habits by counseling them about the prevention and the health promoting behaviors. Physician counseling is strongly related to his own health practices. We know that a physician who is aware of and also practices healthy lifestyle is more likely to counsel his patients in that vein, while those who are unable to practice these healthy behaviors for whatever reason are unlikely to bring up the issue and will probably stick to dealing with just the symptoms and the specific management of those symptoms. So addressing the provider's own health behavior is actually key to substantially increasing health promotion counseling in general practice. I'm aware that there is a lack of time for most of our outpatient settings to discuss lifestyle changes for patients, for instance. But the thing to understand is that if a physician benefits and believes in the healthy lifestyle behaviors, she will automatically bring it up in the consults, and she may need to refer the patient to a qualified lifestyle medicine physician for further management. But since the patient has faith and trust in you as her primary health caregiver, what you say to her makes a world of difference. And this is possibly only when a physician herself benefits from and believes in the benefits of a healthy lifestyle. So the term physician heal thyself first appeared in the Bible in Luke 4.23, and is another way of saying we won't believe a word that you say until you take care of what ails you. So I think, in other words, physicians should care for themselves in order to better care for the illnesses of others. This, of course, is never taught to us during our long and arduous medical curriculum. In fact, quite the opposite is expected of young medical students: long hours, sleepless nights, enormous course material, all of which is expected to be endured without any complaint. And once you become a qualified physician, it gets even worse and more challenging as we try to keep up with the ever-expanding medical literature, endless documentation, patient care, conditions under which we work. Patients that I've worked with, when they come some sort of chronic disease, they cite no time as the primary reason that they're unable to fit in exercise or proper healthy lifestyle. So they say that there is no work-life balance, and often leading to problems at home with the family, in addition to the stresses at work. So the first of physician healthcare is self-awareness, self-knowledge, and a dual awareness of both his or her own subjective experience and the needs of the patient that has been identified in the field of psychology as a most important factor in the psychologist's ability to function well in the face of personal and professional stressors. So greater job engagement and compassion and satisfaction and enhanced self-care is what we see when we improve self-awareness. Improved patient care and satisfaction has also been observed. And some of the ways in which we can improve self-awareness is the various kinds of meditation practices, and of course, journaling, which I will discuss the meditation later. So some of the strategies that we can include in our self-care is what I'm going to be talking about today. As I've already mentioned, a broken system where we are not really nurtured to take care of ourselves is not an excuse not to care for ourselves. It's actually a call to action. Physicians should consider a critical shift in thinking so that one prioritizes caring for ourselves as an effective way of caring for other people. So there are some of the practices which come under the pillars of lifestyle medicine, which is exercise, diet, sleep, stress, paying attention to relationships, and avoiding addictions. And I will also touch upon some aspects of positive psychology like mindfulness, self-compassion, gratitude, positive emotions, empathy, and finding meaning and purpose in our lives. So exercise is probably one of the most widely researched modalities for better health. We know that exercise has several benefits, chronic diseases that humans face, including metabolic disease, cancer, pulmonary disease, immune dysfunction, musculoskeletal disorders, and neurological disorders, and the prevention and management of type 2 diabetes. Exercise promotes healthy aging of the skeletal muscle, preventing sarcopenia or the decrease or the depletion of skeletal muscle mass. And it prevents and manages depression, which is a neglected intervention in mental health care. Now, besides the physical benefits of regular exercise, one of the most important benefits is its effect on mental health. There are various neuromodulators, neurotransmitters, and hormones that are released when muscles contract during exercise, such as an increase in endorphins, like anandamide, which increases mood elevation, the increase in brain-derived neurotrophic factor, which encourages neuroplasticity, mitochondriogenesis, which increases energy levels, attenuation of the HPA axis, reducing stress, reduced inflammation, where there's decrease in depressive symptoms, increase in mastery and self-efficacy because of the discipline that exercise encourages, distraction from negative thoughts, and the release of what is called as a hope molecule, or the cytokines, which are released from the contracting muscle, which actually cross the blood-brain barrier and literally infuse us with exercise can boost mood, and exercise was able to independently reduce the risk for depression. So there is epidemiological data to suggest that active people are less depressed than inactive people, and people who were active and stopped tend to be more depressed than those who continued their exercise program. So exercise is one of the very important modalities. Now, in this systematic review of 10 studies by Nasinski et al., it was found that there is a moderate to strong inverse relationship between exercise and burnout, especially the exhaustion component of burnout. Contrary to common belief that feeling exhausted, which could well be emotional exhaustion, not necessarily physical exhaustion, can actually impede exercise, it's known that some amount of exercise can actually overcome exhaustion. I always tell my patients to start with a moderate paced walk, planning maybe about 10 to 15 minutes. And once you begin to start walking, however, the chances are that you will continue for about 20 to 30 minutes. Now, a note needs to be made here about the difference between exercise and activity. Exercise is structured movement and involving the larger muscles of the body, especially the larger leg muscles, for a stipulated period of time with a specific goal in end, such as increasing fitness levels, loss of weight, etc. Whereas activity is something that we do on a day-to-day basis, which is, carrying the laundry, walking up and down the stairs, cleaning the house, and so on. And both of these are extremely important to prevent depressive symptoms and prevent and also improve mood and reduce depression. Sedentary living has been found for burnout. And what do we mean living? Anybody who burns less, who has a characteristic 5 METs, which is a metabolic equivalent. MET is a metabolic equivalent, and which is about how much energy you spend while just sitting around or reclining or lying down. So as you increase your levels of activity, it reduces your levels of sedentary living, and that in turn increases your level of well-being, your level of improved mental health, and reduces burnout. One of the important aspects of exercise is that the discipline that it incorporates allows one to feel more in control of one's own life. So we feel that we can control at least that 30 or 20 minutes that we actually exercise, and gives us a sense of mastery or self-efficacy in our lives. There has been several studies that have made the connection between exercise and happiness, 15 observational and 8 interventional studies which investigated the relationship between physical activity and happiness. The available evidence indicates that positive relationship between physical activity and happiness among a very wide range of population, and as little as 10 minutes of physical activity per week, or even 1 day of doing exercise per week, makes a huge difference in happiness levels. And this is very encouraging. So it doesn't mean that you have to exercise for very long hours. Even just 10 to 15 minutes a day can actually improve mood and well-being. So a basic training routine, WHO recommends 30 minutes a day or 150 minutes a week. So at least 30 minutes a day to keep your mind alert and sharp 5 to 6 times a week. Strength training needs to be included to prevent sarcopenia and to improve muscle mass. And as I already said, release hope, the hope molecule or the cytokines, which improve optimism and hope, at least twice a week. Some rejuvenation practice for about 10 to 15 minutes, like stretching, yoga. This can be done as often as possible. And in addition to this, prevent sedentary living by trying to complete at least 10,000 steps in a day. Now, diet is another aspect of our lifestyle, which is very, very closely related to well-being. In this study by Pentinen et al., they used the Obgyn burnout indicator to assess burnout among Finnish municipal employees, and they found that the consumption of healthy food items had an inverse relationship with the severity of burnout symptoms, independent of age, education years, physical activity, and depressive symptoms. So the studies that have brought to light the importance of diet for mental health, for instance, one study by Villegas et al. Showed that there was a 40% increase in depression scores for those who consume primarily fast foods, which are typically processed or fried with very high levels of taste-enhancing ingredients like sugar, salt, starch, fat, etc. There is an increase in depression in those who consume more trans fats, typically those found in fried foods and processed meats, a higher rate of anxiety with increased consumption of refined grains and sugary products, and a deficiency of micronutrients like B12, zinc, folate leads to mood disorders and needs to be watched for and supplemented with whenever necessary. So ideally, your diet should be a whole food plant-centric diet, which means that a majority of your plate should focus on plant products, and that to whole plant products, not processed products. So elimination of processed foods and sugar, keeping oils and added fats to the minimum, focusing on a plant-centric diet, which is anti-inflammatory, which has high nutrient density and also feeds our microbiome. As you know, the microbiome in our gut is it plays a very key role in our mood and other metabolic functioning in our body. This kind of a diet is also sustainable and satiating, rather than following a fad diet that is often not sustainable. Now, sleep is another aspect which plays a critical role in promoting health. Disrupted circadian rhythm can lead to various disorders like infectious diseases as our immunity drops, coronary vascular disease, even cancer, autoimmune disease, depression, anxiety, increase in pro-inflammatory markers like interleukin-1, affects performance and decision making. Obviously, you can't make executive decisions when you are sleep deprived. There is an increase in irritability and a breakdown of social relationships. There are several biological mechanisms that underlie the influence of sleep on every system in the body, including the body's adaptive and innate immunity, including our response to vaccines and antiviral responses and infectious diseases. Now, lack of sleep produces pro-inflammatory immune responses with implications for cardiovascular disease, cancer, and depression. It's also interesting to note that all psychiatric disorders seem to be associated with sleep disruption. And remember that severe sleep disruption can lead to severe psychological breakdown and burnout. In addition, long working hours, shift work, which most of us are actually participating in, even those of us who are not necessarily specifically shift workers, but we are woken up at night, like an obstetrician like myself. We're woken up at night several times in the night, sometimes, which disrupts our sleep. Excessive travel and jet lag, screen time, and stress can all result in sleep impairment, and consequent of sleep deprivation can be devastating. For instance, research has shown that the effect on performance of even moderate levels of fatigue as a result of sleep deprivation are comparable to alcohol intoxication. And yet we are never really pulled over for a lack of sleep. So circadian misalignment, which is, it's not just a sleep deprivation, but sleeping at the wrong times, as shift workers do, is these and other unrecognized sleep disorders contribute to insufficient sleep and improper sleep, and our interventions to promote healthy sleep may also reduce the susceptibility to burnout among both attending physicians and practicing physicians in non-academic settings. Now, we all know that the sleep deprivation is a problem, but there seems to be a kind of gap in knowledge and robust sufficient studies focused on sleep among attending physicians need to increase in order for us to pay more attention to the fact that while we are going through a medical curriculum and while we are practicing, we are encouraged, in fact, to be deprived, to not pay too much attention to fact deprived. So, what are the ways in which we can improve? First, the awareness of the importance of sleep. Practice, which means time sleep to be regular night is fine, but try and get in time. Temperature room, keeping it slightly management, keeping the room dark and a warm before sleep, which is difficult in today's age, but at least for an hour before sleep, we need to cut the blue lights from screen. Practice mindfulness meditation and other mindfulness practices, or yoga nidra, which is another guided meditation, which is extremely helpful into a deep sleep. Regular exercise early day, eat early, at least 2 to 3 hours before bed. Avoid alcohol. Contrary to the common belief, alcohol does not give you a better night's sleep. In fact, it disrupts your sleep and reduces REM sleep. Also, early morning light into the eyes
I hope you all will bear with us because Dr. Nambiar said there was a problem in her internet connections. That's something to do with the local setup in India. Yeah, she's back again. Pardon me, ma'am. Your screen sharing is not coming up. Sorry to have disturbed you. You got disconnected in between. Fine, thanks. We see you again.
Can you see now, Dr. Bihan?
Yes, we can see you. We couldn't hear you for a short time also. Yeah, we can see you clearly now.
Now you can see.
Thanks.
Okay. So the term burnout was coined by Maslach in 2003 as a response to long-term interpersonal and occupation stressors on the job. And stress is a natural physiological response to a stressor, like the racing heart, sweating palms, etc. But stress can either be motivating enough for progress, or it can completely overwhelm and paralyze the person, depending on the mindset of the individual towards stress. So burnout is really the end of the spectrum of exposure to chronic stress. So the point is, when dealt with in a timely manner, stress can actually be managed much better, preventing burnout. Most of the physicians, stress comes from long working hours and thankless work, especially in the day of documentation and EMRs, which can be very helpful, but most physicians feel that one is not doing what one loves to do, which is actually healing. Obviously, burnout is an organizational problem and does need to be addressed by the organization as well, but very often it's not. So it comes upon us to actually try and deal with it ourselves by practicing certain behavioral lifestyle habits which can improve our management of stress. So here are some of the ways to manage stress. Mindfulness meditation or mindfulness-based stress reduction practices, setting better boundaries, being able to say no when you absolutely don't need to do something, relaxation techniques, exercise and yoga, managing your expectations, because sometimes expecting to lead a perfect life with a perfect work-life balance, for instance, can actually add to the stress. Focus on what you can control and not focus so much on what you can't control. Time in nature, time with your pets, and of course, time with your friends and family who support you can be extremely helpful in managing stress. Now, social connections is one of the most important aspects of human well-being. And this has been shown by several studies. I think all of you would have heard of the Harvard study of adult development, which is now in its 8th decade, where they followed Harvard graduates and the inner city boys. And at the end of their lives, or towards the end of their not end of their lives, but as they kept interviewing these people, and some of the insights that they came to, as Dr. Robert Waldinger, the current director of the study, says, the surprising finding is that our relationships and how happy we are in our relationships has a powerful influence on our health. Taking care of our body is important healthcare too, and that, I think, is a revelation. So this is a very, very important aspect that we need to understand. Authentic relationships leave us feeling supported, loved, and valued by others. Social connections become even more important as we age. Good supportive relationships have been shown to reduce depression, anxiety. Author Southwick et al. In this paper published in JAMA Psychiatry in February 2020 stated that while many interventions to reduce burnout have been proposed, none is more important in our view than addressing the fundamental human need to belong. Lack of social support from colleagues, family, friends can be detrimental to health and well-being. So relationships are important because relationships make a difference. Now, this by relationships that make a difference, I mean that we need to understand what our toxic relationships are and eliminate those, or at least step back from some of our toxic relationships, while at the same time move towards our more authentic relationships. We know that people matter. Positive relationships protect us. Positive relationships create a space for us to grow and flourish. And positive relationships help us create meaning. Positive relationships create positive emotions. And there are many ways of improving social connections. Nurture your authentic relationships, put in the effort. I think as physicians, sometimes we get so caught up with our work that we don't reach out to people. We have no time, we are exhausted, but it takes even just a phone call to an old friend or to somebody that we are close to can make a lot of difference. Create deeper friendships with people that you're acquainted with. Get in touch with people that you have not spoken to or connected with in a long time. Join a class or a course or organization or group that can interest you. Start conversations, be curious, create different levels of connection, and take some time to reflect regularly on your relationships. So all relationships don't need to be deep and meaningful. Even superficial positive relationships where you're talking to the person, let's say in your grocery store at the checkout counter, or just saying hello to the watchman, all these things induce positive emotions, which are found to be protective and improve health. Now, alcohol abuse or dependence was associated with burnout, and in this cross-sectional population multidisciplinary study, Health 2000 study by Ahola et al., they found that there is an association between burnout and alcohol dependence among both genders. Each 1-point increase in burnout score was associated with an 80% increase in incidence for burnout scores in women and 51% increase among men. Although there is an association between alcohol dependence and burnout, it was not statistically significant in this particular study. However, attention to alcohol-related behaviors warranted in clinical contexts and when burnout and other problems related to work are encountered. So it's not just alcohol. There can be many other forms of addiction, which could be addiction to food, nicotine, internet, shopping. There are several forms of addiction, and addiction is just something that you cannot control, that you feel withdrawal from when you stop, and that can have long-term repercussions. And despite knowing the long-term repercussions, you continue with the behavior. That is the definition of an addiction. So it doesn't necessarily have to be alcohol. It can be any other form of addiction. So let's look at some of the positive psychology interventions. Positive psychology is the science of a life well lived. It goes beyond psychopathology and the idea of just treating a mental disorder or a psychopathology. Instead, it explores the concept of human thriving, or how do we live our best life to our optimum potential. Various practices like gratitude, recognition, and development of positive emotions, nurturing healthy social connections and community, and the concept of finding meaning and purpose should be addressed in positive psychology. Now, self-compassion is something that is key to preventing burnout. Self-compassion involves being open and moved by one's own suffering, experiencing feelings of caring and kindness towards oneself, taking an understanding, non-judgmental attitude towards one's inadequacies and failures, and recognizing that one's own experience is part of the common human experience. And there are three aspects of self-compassion. One is kindness. According to Christian Neff, this wonderful paper by Dr. Christian Neff, psychologist, she describes three aspects of self-compassion: kindness, humanity, and mindfulness. Humanity, it just means that you recognize that what you're experiencing is common to many, many people. It is not just something that only you are experiencing, and that should give us some sort of solace. Kindness is being kind to oneself, not being judgmental, not being overcritical. It is what it is. So you move on from there and, of course, improve, but not being judgmental enough to berate yourself and feel worse. and mindfulness practices where you remain in the present and not necessarily project yourself into the future and start imagining all kinds of different scenarios will help in improvement of self-compassion. Mindfulness is a concept that stems from the Buddhist psychology and teachings, and it was made reference to more than 2,500 years ago. Mindfulness practices improve empathy, they manage stress better, they improve the quality of life and reduce stress, anxiety, and depression, definitely improve mood and improve sleep. Now, mindfulness is in its most basic form is nothing but self-awareness, and it is the practice of watching, observing, reflecting, and listening so that you see the present as it is with acceptance, that is, without judgment. So for physicians, the benefits of mindfulness extend beyond personal stress reduction and improved health. What it does is allows you to accept what is happening in the current moment and move forward. So mindfulness practices like mindful meditation, loving kindness meditation, all of these will help in allowing us to recognize our thoughts and recognize that they are just thoughts and that's all they are, and remain in the moment rather than projecting ourselves into the future or worrying about the past. Mindfulness meditation practices help you stay in the moment, to be cued into your own, what's called as introception, which is your recognition of your body's signals. And what it does is actually it helps you recognize the early signs of burnout. As I said, most of us don't recognize the signs of burnout. So it identifies behaviors that can be detrimental to health, like stress eating, addictive behaviors, poor sleep habits, etc. Ability to manage emotions and responses better, manages relationships with colleagues, bosses, family, etc. better, manages difficult patients and bosses, and mitigates stress or buffers stress. Now, empathy is another aspect of our lives, which I think we need to pay attention to. Now, psychological struggles, which include secondary trauma like PTSD-like symptoms associated with witnessing other people's suffering, leads to what is called as compassion fatigue. So when we keep watching other people's struggles, as we often do as doctors, we could go into what is called as compassion fatigue and leading to burnout. We also have what is called as defensive dehumanization, where we dehumanize, or we almost dehumanize the patient and make in order to help us feel better about the whole traumatic situation. And we, in fact, sometimes could even blame patients for their own suffering. There are three types of empathy. Emotional empathy, where you get completely wrapped up or emotionally involved with the patient's or with other people's feelings. Cognitive empathy, which just infers what other people feel and why, not actually engaging or not actually relating emotionally. Whereas empathic concern is a desire to help other people without really getting wrapped up with the emotional aspect of it. So of the three of them, empathic concern is what we should be feeling in order for us to prevent burnout. Now, in this beautiful paper by Jamil Zaki, he talks about the caregiver's dilemma, where we are often aware that we are constantly being faced by having to be empathic, but at the same time becoming overwrought because we are empathic, and therefore possibly leading to burnout. So what do? Do we stop being empathic, or do we completely become detached from the entire situation? But his answer to that is to actually practice what is called as empathic concern. So most of us will face the caregiver's dilemma. And I think the way around it is to practice things like loving kindness meditation, compassion meditation, and of course practice the various aspects of self-care, as I've already spoken, like exercise, diet, sleeping properly, sleeping at the right time, etc. And we need to understand that empathy, especially empathic concern, is a skill that can be learned, to move away from just emotional empathy to empathic concern, for us to be our most effective selves to our patients. Now, gratitude is another aspect of which has been hugely researched in positive psychology. And when we ask the question, what is gratitude and where does it come from? And why do some people why are they more naturally grateful than others? Are there ways to become more grateful? Is it an emotion? Is it a virtue? Is it a behavior? It's all of the above. Robert Emmons and Michael McCullough define gratitude as a two-step process. That is recognizing that one has obtained a positive outcome, and also recognizing that there is an external force or a person for this positive outcome. In other words, someone or something or a greater force outside of yourself is responsible for this positive outcome, and feeling grateful for that. Gratitude has been shown to increase well-being and prevent burnout. So just writing, one of the experiments that was done was getting people to write 3 things that they were grateful for every night in a journal. And it was found that 6 weeks into this experiment, people felt more happy and they were able to deal with life stressors much better. Now, there is accumulating evidence that positive emotions are associated with several advantageous physical and psychological health outcomes. Now, by positive emotions, I don't just mean happiness. It could be many things like amusement, joy, love, gratitude. All of these things count as positive emotions, and most of us don't really recognize all these small emotions as positive emotions. The point is to identify them as positive emotions, recognize that we are feeling these emotions through the day. So it could be the joy you feel when your pet runs towards you, or your child hugs you, or the delight you feel when the morning breeze blows on your face on your morning walk. All of these positive emotions, even if it is a micro moment of positive emotion, helps us improve our sense of well-being. And as Barbara Fredrickson, one of the pioneers in pioneer researchers in positive psychology, she coined the word broaden and build theory, which is nothing but when we feel several positive emotions through the day, or we recognize several positive emotions through the day, it helps us broaden our thinking and build our resources, whether it's emotional resources, social resources, psychological resources, and helps us be better in every way, better productivity, better bosses, better employees, even more successful, and even make more money. Happier people who feel more positive emotions have been found to be more successful. So it's not just that success creates happiness, but happiness also seems to engender success. So recognizing positive emotions and increasing your vocabulary for positive emotions. Don't just use the term happiness. There are several positive emotions. Recognizing that is important to our well-being. So purpose can be defined as a commitment to a clear set of aims or causes that direct actions while also leading to a sense that life is meaningful. It helps people deal with stress and feel a greater sense of personal control. A purpose commitment emerges as the strongest predictor of well-being, significantly predicting greater life satisfaction and positive affect and lower negative affect. Now, purpose is not to be confused with goals. So several goals can lead to your overall purpose. So for instance, if your purpose in life is to be a healer, then you may have several goals, such as passing a particular exam, taking a particular course. Now, those are smaller goals, those are short-term goals, and all those goals can actually lead to a definite purpose. It's been found that people with a definite purpose seem to be able to manage very, very difficult situations in a much better way than those who are not able to identify a purpose. Human beings are meaning-making machines. Our will to live, to succeed, to thrive, to overcome struggles and tragedy is linked to our resilience and to the meaning and purpose that we find in our own lives. Now, we're also very resourceful. We can find meaning in any context. We can find meaning in the sublime, in the absurd, in the dull, dull and in the dreary. We can even find a purpose in a perfectly wretched life. Now, Friedrich Nietzsche said it best when he said, "He who has a why to live can bear almost any how." In other words, when we have a reason, something that drives us beyond the obvious, like money, name, and fame, it's easier to get through life's vicissitudes without feeling overwhelmed or purposeless and defeated. A great book to read in this context is this book by the Austrian psychiatrist and the Holocaust survivor called The Man's Search for Meaning, by Viktor Frankl. Another book that I found very moving was Breath Becomes Air by the neurosurgeon Paul Kalanidhi, who lost his battle to cancer. These books bring to light hope and meaning and purpose in the most trying times. So the question of, is there really a work-life balance? A lot of our stress, I think, is a result of trying to achieve this perfect work-life balance. Now, this is, however, an elusive concept, especially in professions like ours, where the demands are so much, and it's extremely difficult to create this work-life balance. Work-life balance is rarely, work and life is rarely in balance all the time. It's more, if you ask me, more of a balancing act and not a perfect balance. So for this reason, let's not struggle to create this perfect balance and have the expectation that work-life balance will always work. Work-life balance is the individual perception that work and non-work activities are compatible and pronounce growth in accordance with an individual's current life priorities. But sometimes it may not always work, and it's okay that it doesn't always work. The point is that we need supportive relationships in our life, which will help us to sustain some semblance of balance, even when there seems to be none. So understanding that everything is connected, that is, our self-care is closely interrelated with the better productivity, a better life experience, and the prevention of burnout is essential. Self-care is really not selfish at all, it's mandatory. And if we want to lead full, flourishing lives, we need to try and inculcate some of the lifestyle behavioral habits that I've already alluded on. We may not be able to implement all of them, but at least try and implement them and become aware of the concept of burnout in order for us to prevent it, or at least recognize it as early as possible. So why are we even discussing the topic of happiness? Because I think happiness is something that all of us want to achieve. From time immemorial, I think the main aim of human being is to be happy. And preventing burnout and helping with physician self-care, helping us to be better people, is also an absolutely essential part of happiness. As Blaise Pascal, philosopher and mathematician, said, all men seek happiness. This is without exception. Whatever different means they may employ, they all tend to this end. The cause of some going to war and others avoiding it, the same desire in both, attended to with different views. So self-care is giving the world the best of you instead of what's left of you. So on a final note, let's just recap that we need to prioritize self-care by working first on improving our own self-awareness, what drives us, what gives us purpose, what gives us meaning, what makes us happy, who are our authentic relationships, which are the relationships that we need to stay away from. Live and in the present without judgment, prioritize lifestyle habits like exercise, sleep, and healthy diet, manage stress effectively and in a timely manner, be cognizant of addictive behaviors which are very easy to creep up on us, express gratitude and develop empathy, recognize positive emotions, nurture authentic relationships. People in your life influence your health and well-being, so choose wisely. Your behavior influences your health and vice versa. You can control much of your behavior. Focus on what you can control instead of stressing about what you can't control. Accept that work-life is a balancing act and not always a perfect balance. And recognize that everything in life is, and I hope this was not too disrupted. I think the internet kept going off. I hope you were able to hear much of what I was saying.
Thank you very much, Dr. Nambiar. Thank you very much for that mind-blowing lecture. Actually, it was a wonderful, eye-opening lecture. I think this is personally, this is my first in this lifestyle medicine, and actually, I was stunned by all the facts that you have provided. I hope the whole forum is the same. So let's go into what they want to know. So anyone who wants to ask anything from Dr. Nambiar, this is your time. This is the time for Q&A session.
Excuse me. Can you hear me?
Hi. Hi. Yes, I can hear you. Can you hear
Yeah.
me, Dr. Sheela?
Yeah, I
Yeah,
want
I
to
can
ask
hear you.
how, as a doctor, we can choose to become a lifestyle physician. How is the pathway?
So any physician, any specialty can become a lifestyle medicine physician. I think Sri Lanka itself has a society of lifestyle medicine right now. And through the Sri Lankan Society of Lifestyle Medicine, you can actually sit for the board certification of lifestyle medicine, which is an international board certification. They have an exam, and they have, in India, our society has its own set of lectures to help the participants sit for the exam. The exam is usually towards the end of the year. We just finished our exam. So anybody can join any physician with a undergraduate MBBS degree can join the society and sit for the exam. And I would highly encourage, even if you don't sit for the exam, I would highly encourage you to join the society so you can understand the concepts of lifestyle medicine. So it's not that everybody can practice lifestyle medicine. I completely understand that, as physicians, you're very busy, and, there's not that much time to go through all the various pillars of lifestyle medicine with every patient. But the fact that it's on your mind, and even if you just do a very small, short questionnaire with every patient, even while they're sitting outside in the waiting hall, can help you kind of identify which is the aspect of their life that needs the most attention. So please go ahead and join the society. I think, Rosari, you're a member of the Lifestyle Medicine Society.
I'm actually the vice president of membership. So thank you so much for the advocacy.
Yeah.
In my thank you so much.
It's something that I think all physicians should be exposed to. You don't necessarily have to take the exam, but once you're exposed to it, the way you treat patients just changes completely. Because we realize that so much of the problems that they come to us with are based on their lifestyle. And I'm not saying that this is against allopathy at all. We continue to prescribe the medication that's required. We continue to perform the surgical procedures that are required. But at the same time, we also implement lifestyle measures so that even the healing post-surgery becomes so much easier. Delivery becomes so much easier. As an obstetrician, I've been practicing it for years, and I find that patients who exercise regularly, etc., they have an easier delivery, they have a post-delivery recovery is much faster, so the benefits are enormous.
Any more questions?
Yes, I actually have a couple of questions for Dr. Sheela. Whatever you're able to answer, that would be like really great. Dr. Sheela, now when you're an obstetrician and you get disturbed in the middle of the night, are there any tips or strategies that you can tell us? Because most of our doctors do on-call shifts, and sometimes they do have night shifts, and sometimes even if they don't, they get sort of continuous calls. And anything that can help them sort of maintain the quality of sleep.
I wish I knew the answer to that, Rosari. I've been trying to find the answer to that myself. It's a very, very difficult situation because you are woken up and then you go into those bright lights of the labor room, so you're completely awake. Then you come back and then you're trying to sleep, and very often you're playing the delivery in your mind. I personally am just unable to get back to sleep immediately. I really don't have the answer to that. you know. And one of the things though that I can say is be mindful of the fact that you can have a very different relationship with even food when you are woken up regularly during the night. For instance, you come back from a night call, you may feel that you need to eat something. You may think you're hungry. You're not really hungry. It's your body telling you you're fatigued. I used to do that. I used to head for the fridge. So just be mindful of those things. And the other thing to say is that if you have had a disrupted night, a short nap during the day can to some extent take care of your sleep debt. So about 20 to 25 minutes in the day, not more than that, because again, that disrupts your night sleep. But about 20 to 25 minutes, maybe in the afternoon, can actually take care of your sleep debt. And the other thing is that if you are used to exercising, the nights that your sleep has been disrupted, don't attempt to go through your regular exercise if you're used to exercising in the morning. Shift your exercise routine to the afternoon. So those are the two things that I found helpful, because at one point I used to get up to exercise irrespective of if I was disturbed or not. And I found that that was actually extremely stressful and extremely detrimental. So sleep in if you can, and then exercise later in the day, and perhaps have a little nap slightly later in the day, and be mindful of your eating habits, because that's a killer. You know, reaching for some, and now Diwali is on here in India, so there are plenty of sweets around, so we need to be a bit careful about that. I hope that
Thank
answers your
you.
question.
I know I've been looking for the answer myself, so I was wondering if you had any new insights. So thank you so much. Thank you so much. Just one last question. Now, like this is like a topic that I'm like really crazy about, and it's when you first hear about it, it can be a lot. Like you feel like, oh my God, like we're all trying so hard to take care of our patients, and it's not easy being a doctor. And in countries like ours, like where there are various systems, and we are under a lot of pressure. And then when you hear about these pillars, you start to think, oh my God, like I'm doing so many things wrong, and I'm at a lot of risk. So without being overwhelmed, where do you think is the easiest place for us to start? Any experience that you might have? And thank you.
I think one of the most important two of the most important things are exercise and sleep, because they are behaviors. They are behaviors. So you see, the mind, if you are feeling anxious or depressed, this is just me, and this is only from personal experience. When you're feeling disturbed, you're feeling anxious, and you're feeling stressed, it's very difficult to talk yourself out of a bad mood or a difficult frame of mind. For me, what helps is movement. So even if it is a 10-minute and when I say movement, I don't mean a whole 45-minute workout, which may not be possible. But even if you get in a 10-minute workout, 10-minute brisk walk in and around your house, you will find that the frame of mind changes, because the neurochemistry changes within your brain. So our most common response to stress or to feeling down or to feeling upset is to sort of go within ourselves, to reach out for food, to withdraw. But you actually need to do the opposite behavior for you to be able to get out of that frame of mind. And the other thing I think is, if we could all just sit down and write down what we are doing from morning to night in a journal, wake up at whatever, 6 o'clock or 5 o'clock, and just write down from this time to this time, this is what we do. You'll be surprised that there are several time wasters that we have, and most of it is scrolling the internet. A lot of it is scrolling the internet, responding to WhatsApp messages, responding to emails that can wait. So if we are able to identify that, we could probably move that to a different time and set aside a certain time, say between 6 and 7 p.m., where you will look at mails, and other than that, you will not look at mails at all. So it's also a little bit of discipline that needs to come into our lives, because as you rightly said, we think that we have to look after our patients and be there for them 24/7. That's not possible. It's just not possible. We have to look after ourselves as well. And the experience that I spoke about of my colleague committing suicide, it was such a shocking experience for me. And like I said, what was more shocking is that nobody really responded to it. Nobody really, there was no support system. And obviously she had no support system. She had nobody to reach out to. So we don't need to reach that point. And when you are in burnout, you don't recognize it. So before you reach the stage of burnout, you will have to take small steps like movement and the right kind of food, which will definitely help change the mindset, change the way you think and your executive function, in order for you to make better decisions for your life. Does that answer your question?
Thank you. Thank you so much. Yeah. Every little bit helps. And I often feel like self-care is seen as selfish, and within the system itself,
it's not.
it's very difficult. It's very difficult
Yeah.
when people expect you to keep things together all the time. But I'm really happy that the college is spreading the message that, first the doctors need to take care of yourself. Thank you so much.
Thank you so much.
So
Thank
would
you,
you
Dr. Sheela. Sorry, Iranta here. Just want to personally thank you as well. You're taking your precious time off your family with Diwali dinner and all to be with us. Thank you once again.
Thank you. Thank you so much.
Thank you.
So would you care for another one question from the chat, Dr. Sheela?
I'm okay. My internet seems to be fine, so I'm perfectly fine. I was just worried about that, yeah.
This question, if a physician has no time or too exhausted to exercise, I think we've almost had the answer. What else can they do while at work to keep themselves physically active?
Yeah, so there are small, short little exercise routines that you can even do at work. Like if you're sitting for a long period of time, dealing with patients, even 5-minute breaks, exercising in your own cabin, walking the corridors of the hospital, briskly walking the corridors of the hospital, all of that does help. It makes a huge difference. Even just getting up every half an hour from your seated position and just walking around does help. And in fact, there was a paper recently which talked about calf raises, that is heel raises, while you're in a seated position, appears to actually lower your postprandial glucose levels. So even if you are not able to get up and do anything, just doing hundreds of heel raises under your desk seems to help. So even small, what I'm trying to say is it doesn't have to be one long stretch of exercise. It can be just 10 minutes. And if you can include the 10 minutes 2 or 3 times a day, it will help. And like I said, if you can just write down the things that you do from morning to night, you will find a time which you can fit in at least 10 to 15 minutes of exercise. And include it with other things. For instance, if you're going to meet a friend, instead of going to sit down for a coffee, you can go for a walk. Or if you have a meeting with somebody, and I've done this, I've said, why don't we just walk and, discuss something instead of sitting at a desk, across a desk and talking to people. It's a cultural thing. I think if we all do it, and if we all start practicing it, then it becomes the norm. So the more people who start getting physical and start insisting that we have to be physical and that we need breaks and that we need to get out and walk, it becomes more normal. Right now, the problem is that the whole system is geared in the opposite direction. And that's why we are struggling so much to even get in basic self-care, So let's all try and do something in our own small ways, encouraging each other to walk, encouraging each other to go for walking meetings, encouraging each other to climb stairs instead of elevators and lifts. Even even if you climb 5 flights of stairs twice a day, that makes a huge difference. And as far as weight goes, of course, diet is the most important thing. And that is something that we need to really dial down, just focusing on a healthy whole food diet and restricting our eating time. I think one of the problems doctors face is that we eat very late because we come back from clinic and then we eat at maybe 9 in India, 9 o'clock, 10 o'clock is norm for dinner, and that's way too late. So if we can eat a little earlier, perhaps eat while we are at work and then come back and maybe just have a fruit, it would make a difference. Because if you look at Dr. Sachin Panda's work, he talks about the circadian rhythm and the misalignment of circadian rhythm. He says just restricting your feeding time to 10 to 8 hours, 8 to 10 hours in the day. That is, the rest of the day, 24 hours, you are fasting. Just restricting that time helps with everything from weight loss to better health. So even something as small as that can really make a difference.
Thank you very much. I think there are a lot of responses coming that it's a timely eye-opening lecture and all this. I think we all would have experienced the importance of this lecture. Actually, for me, it was mind-blowing, actually, because now it was like reading myself. You're reading my mind, actually, and describing the problems. Yeah, I hope the whole 32 participants, yeah, it will be the same. I mean, it would not be different than in India. So I think I once again thank you very much on this very important day to you, reserving your time for the Sri Lankan medical fraternity and sparing your valuable knowledge and sharing all your experience and contributing to our physicians so that they will not burn out, that they can find an answer through your lectures. Thank you again, Dr. Nambiar. This is actually with a lot of practical difficulties with the internet also going down. We managed to go through this session. And on behalf of the College of General Practitioners, I thank you and I wish you a very happy Diwali tomorrow. And for the participants also, thank you for attending this very important webinar. And I hope that you enjoyed it. And let us meet in the next CME session from the College of General Practitioners. Thank you and good night to you all.
Thank you so much.